We're looking for two specific antibodies, cytolethal distending toxin, as well as the body's host vinculin, which is an autoimmune response that's created. It was validated in a 2,500 patient study comparing an IBS cohort to that of IBD, celiac, and healthy controls, and was found to have a 90% specificity. So very substantial specificity and can provide some objective data in an area where there hasn't been much of it prior to this. So it works by identifying a bacterial toxin that is associated with acute gastroenteritis, and specifically Campylobacter jejuni, and its cross-reactivity with the body's host vinculin. So it's an antibody detection response. It's a kit-based component that is sent out to the physician's offices to collect and transport the specimen back to Commonwealth laboratories to analyze using ELISA, so an enzyme-linked immunosorbent assay test, and we turn the results around within 24 hours of the time that we receive it. So the physician can get that data, they can get it quickly, and they can move toward a targeted therapy of their discretion. The traditional method of diagnosing irritable bowel syndrome has been that of an exclusionary pathway. So a lot of times the patients are subject to more invasive, costly exploratory tests such as colonoscopy, some CT scans, blood tests, things like that, to rule out other anatomic deficiencies before coming to more of an empirical diagnosis of irritable bowel syndrome. So this will really give some more objective data for the physician to make a confident diagnosis. Original discovery was founded at Cedars-Sinai in Los Angeles by principal investigator Dr. Mark Pimentel and his group at the GI Motility Program out there in Los Angeles. Something that he had been working on for quite some time to detect the specific autoimmune response that was made basically after this bout of acute gastroenteritis. So, very specific interaction between the two and needed to be validated, and it was in a very large sample size. It certainly is up to the discretion of the individual practitioner, how they want to use it as part of their diagnostic modality. But with that said, the team that discovered the technology is confident in its ability to be used as a differential diagnosis between inflammatory bowel disease and that of irritable bowel syndrome. So it's really the first time that a blood test can be used as more of a screening mechanism to include irritable bowel syndrome, as opposed to doing more invasive tests to exclude other disorders prior to making that determination. I think that for internal medicine, I think for primary care physicians, it will make a lot of sense. It will give them the ability to confidently diagnose irritable bowel syndrome, especially in patients that don't have a host of alarm symptoms. For instance, a 25-year-old female comes in with symptomatology that is closely related to what could be suspicious of irritable bowel syndrome, but doesn't have alarm signs. There's no blood in her stool. She hasn't lost a whole bunch of weight. In a situation like that, all the physician would need to do is order IBS Check, find the specific autoimmune deficiency, and they can move directly toward a targeted treatment, as opposed to having to refer downstream and subject the patient to far more invasive testing and a lot longer pathway toward diagnosis, because ultimately you want the answer and you would like it quickly so that you can move toward treatment and start enhancing the patient's quality of life. So it will be very applicable in primary care. In gastroenterology, I think that it also will be used as a screening mechanism, but I think that there will be a lot of circumstances and scenarios where potentially the patient may have already gone through some of the exclusionary pathway. Everything from an anatomic deficiency standpoint has been ruled out, but the patient is still symptomatic. I think that in that scenario, there's a ton of clinical utility there. From here, we want to see what the thought leader community has responded, how they respond to it, as well as community physicians across a multitude of different areas of medicine. But we're excited to kind of get the test out there, allow the patients and the physicians the access to it, and see how they can use that data to hopefully move toward a far quicker diagnosis of a disorder that has affected 40 million Americans, and takes an average of about 5 years to diagnose. That's a long time for patients to suffer. And with this test, I think the patients that have suffered for that amount of time will be very receptive to a test that may be able to tell them why. And additionally, the patients that have suffered in silence and haven't gone out and tried to find a therapy for this or spoken to a physician about it, I think this gives them the opportunity to do that. It hopefully will create some buzz. It will give them the opportunity to find out why they're feeling the way they do and start moving toward a treatment regimen that will make them feel better.